Now, for this next complication is sickle cell anemia. We'll look at what is known as the priapism. Priapism. Okay. So priapism just have to do with you're having some unnecessary what I call it. Your penis is erect and it's unnecessary. Okay. So priapism is a painful penile erection, and it lasts more than 4 hours, and it's not related to a sexual stimulation. So in children, it's actually mostly associated with sickle cell disease. Alright, so that's why I told you guys that it's actually a complication of sickle cell disease. So types of priapism, you have the ischemic, that's low flow. There's painful, a rigid penis caused by obstruction of the venous outflow. So blood is in the penis, but the blood cannot flow out because there's a blockage in the veins, So it's usually seen in sickle cell disease due to sickling in the penile vasculature. It requires urgent treatment just to prevent permanent erectile dysfunction. Then we have the low ischemic, that's high blood, the non-ischemic is also known as the high flow priapism. That one is less painful. It's often due to trauma to the perineum. It's not an emergency. Then we have the Stuttering priapism, recurrent self-limiting episodes, common in sickle cell disease too. So what are the causes of priapism? Mostly is associated with sickle cell disease. Okay, can also be associated with leukemia, can be associated with trauma, can be associated with some side effects of some drugs like anticonvulsants, then antidepressants. Then sometimes the cause is not known, it's idiopathic. Okay, sorry, let me get something. Alright, so sometimes the cause is not known, it's just idiopathic, just like that. So I think that's what we got. So clinical features is you have a painful prolonged erection, a rigid corporal cavernosa with soft glands. Okay, then child may be distressed or crying, and most of the times there's history of sickle cell disease. Okay, so complications could lead to erectile dysfunction, penile fibrosis, recurrence, then a stuttering priapism where it's coming and going back, the psychological distress. The treatment is rehydration, so the child should be on adequate fluids, right? Then analgesics, light physical activities like walking around. Then they should also try to empty the bladder based on voiding or catheterization. Okay, so they can also give drugs like pain controllers, hydration drugs like intravenous fluids, oxygen therapies. Then also they tackle the sickle cell disease that is mostly a culprit for this disease condition, for that medical condition rather.